everyone, this is Michael with Home Health Success Academy, and you're watching our Home Health Marketing Mistakes video series. And in this video, what we're talking about is refusing social media. So if you're a home health agency, a home care company, a hospice agency, and you are refusing to jump in the whole bandwagon of social media or using social media for your company, then you guys are eventually gonna lose, okay? So when home health agencies first started, let's talk about 90s, 2000s, when I got into the industry, and what ended up happening, right? What ended up happening was that we used to market our products, we used to market our companies in newspapers, in magazines, in print items, right? And those were ways for us to be able to get our organizations out there, get our information out there for you guys, but things have changed dramatically, okay? So the print media is still a good way to be able to market your product, but it is not the most solid thing. So larger organizations are starting to realize that social media is a platform that they need to be able to understand and use to be able to market their company. And this is something that a lot of home health agencies are failing to actually absorb and understand that this is something that they should do, right? So whether you believe in, for example, other countries meddling in our elections, right? Or you don't, but they actually have done it. It's been proven by both sides agreeing into it that social media was used to be able to infiltrate and to be able to convince people to have certain ideologies. You have to understand, if you believe in that, okay, or whether you don't, social media is here at this very moment. And social media is a perfect medium for you to be able to get information out there. And the cost of it is for free. And if you're willing to pay more, then you're going to be able to attract more leads and get people more information about your company, about your products and your services. So how would you use social media? So I'm just going to give you guys the basics of how I've used it in the past and how I'm using it right now. Great example is this: how did you hear about our company? Why did you come across this particular video? Well, more likely because of social media. You found it in a Facebook post. You found it from somebody who actually shared this video. You found about our company through YouTube. You found it through either LinkedIn. You found it either through Facebook. We also use Instagram as well to be able to try to capture a lot of people to give them information about our organization. You found our information. You found this video because of social media. I guarantee it to you, okay? So with that said, what are you doing to be able to attract clients? Are you guys aware that the fastest demographics of people joining Facebook right now are people 65 plus and up? So these are your potential clients, people that can refer their mom, their dad, okay? You have physicians there that you can target. You have social workers, discharge planners. You have CEOs. You have everyone who's pretty much using Facebook now. Even your grandma is using Facebook right now. So you guys have to understand that this is a place where people go. It is pretty much networking from the comfort of your home, if you may say. You can network with people where previously you had to go to events. And the funny part is, a lot of home health marketers or owners, administrators, or whoever that wants to get people to know about their company are not even attending networking events. If you want to be able to create success for your company, you should be attending a minimum of 1 or 2 networking events in your area every week. And if you're not doing that, you should be creating your own networking events to get people to come to you. So you guys have to understand that social media is so important. Another study is, let's say, for example, you're using social media. The way you use social media is you go ahead and open up your Facebook account, your Facebook page, and then you just scroll through all of it really fast. Old people, they go really slow. So if you can put some educational marketing materials in there, it's going to be able to attract more people and more leads. We have a whole training in regards to social media marketing that is very much something that is so important that you should actually start implementing in your company as well. So refusing to admit and refusing to use social media is one of your biggest mistakes if you're not doing it. Right now, the cost to be able to enter is free, and the cost to be able to do additional ads is very cheap, okay, to be able to reach a certain amount of people. This is when we start talking about, CPMs, cost per mil, how many people will view a particular post, how much you're going to pay for it. It's very cheap. Like if you used to advertise or you're still advertising in newspapers, can it actually tell you how many people opened up the newspaper? They may give you some amounts and some numbers, but really, can it actually be measured fully? Okay? So Facebook marketing, social media marketing, Twitter, these are good places to be able to attract people and to find the people that wants or probably needs your services. So I'll give you a quick tip. Like for example, in Twitter, you can actually do a search on a particular topic in a particular zip code, so in your area, and see who are having conversations about that. So if somebody's searching and is posting something about CHF, I can do a CHF or congestive heart failure and put my zip code and find out who is having a conversation in that. And I can jump into that conversation and start talking and saying, hey, look, I see that your mom is experiencing some problems with CHF. By the way, here's some information that would be valuable for you that maybe could be used, and so that you have an idea of what CHF is and how to prevent, from these chronic items to reoccur for your mom, to prevent them from going to the hospital, right? So I'm going to start a conversation, and then if they have interest in that, they're going to try to say, hey, thank you so much for the information. What do you do? Then I can start talking about our company and our products. There are so many different things that you can do to be able to get people's attention, to be able to drive them towards educational, based marketing materials that you're going to put in your websites, in your blogs, in your videos that you guys are creating. So you guys have to understand, I'm using social media to be able to attract clients, to be able to get them to see, hey, Michael is giving some great information. What else can he give me? Okay. And at the same time as you shouldn't be charging for these particular items. You just want to be able to use it to get people to see your product and services. And hopefully they see the value in it, that they actually want to be able to ask more to see if you can actually give them all the training, all the services for their mom, their father, their grandparents, or whosoever, or even their patients, for example. So understand that if you don't use social media, okay, you need to start looking more into it. And other than looking into it, you should start practicing it slowly and start getting a feel of how to do it. Not posting, what you ate today, or not posting, where you plan to go or where you're visiting, right? Doing something different to attract people's attention is something that is of value for your company and for yourself. So I hope you guys start using social media. It's a quick tip that I can give you. One of the biggest mistakes is not to even consider, and the biggest mistake is to eventually not actually use social media to be able to get you guys more awareness about your product, your company, and to be able to increase your referrals and your census for your agency. So once again, this is Michael with Home Health Success Academy and 10xpatientreferrals.com. All you have to do is understand that home health marketing is easy if you know what you're doing.